Hi everybody, this is Dr. Chitra, your mentor at StudyEFOG, and we are back with our SSS YouTube series for those of you who are appearing for your Part 2 exams. So today we would be discussing a task and it's called as Breaking Bad News. We all start our sessions with a positive quote for all of you, and just remember that knowledge is not going to be free for anybody, so you have to pay attention to earn a lot of knowledge. So task for today is Breaking Bad News. It is one task that you would be facing in your examination. The task that we are going to do today is about this lady who is a late booker. She has done her ultrasound scan. It's her first pregnancy, and the radiologist or the sonographer has noticed that the baby has anencephaly. So she is referred to the doctor to discuss this case. Okay. In the exam, you will be given 1 minute of reading time, 11 minutes to do the task. Okay. And there will be a role player with you. The marking system and everything we will talk about later. Today, we have a surprise guest with us. We have Dr. Soumya, who has agreed to be our role player. Welcome, Dr. Soumya. I'm sure all of you
Hi,
will
hi.
Yeah.
Yes, please.
Can we begin, Dr. Soumya?
Yeah, please.
All right. Hi, I am Dr. Chitra, one of the doctors in the clinic. Am I talking to Louis?
Yeah, hi, yes.
Hi, Louis. Is it okay if I call you Louis?
Yeah, absolutely fine.
Okay. So, Louis, I gather that you have just had your scan and you are here to discuss the results. Is that right?
Yeah, that's correct. That's correct.
So, Louis, I'm meeting you for the first time. Is it okay if I discuss the results with you first, or could I ask you a few questions, whatever you are comfortable with?
You can go with questions. I'm fine.
All right. Louis, could you tell me a little bit more about this pregnancy?
Okay, actually, the thing is, like this pregnancy wasn't planned, but because my periods have always been irregular, I didn't realize that I was pregnant, and so that's why I couldn't show to anybody as well. And later on, when the midwife said to me that because I was feeling little pukish and my tummy was heavy, that's when I know that I was pregnant, and that's the reason I came. And they said that yes, I'm already 5 months pregnant and I am supposed to get the scan done. But because my periods have been irregular and I was very busy at work, so I couldn't actually think that I could be pregnant. And that's the reason probably I haven't done any tests as well.
Okay. Louis, I hope everything is good at home.
Yeah. So absolutely fine. We are good. But the thing is, like, because I was stuck in a lot in the work and my studies, so that's the reason. Basically, I didn't get time to have a look. Yeah.
Oh, okay, that's fine. Okay. So are you otherwise generally fit and fine?
Yes, I am.
Just a few more personal questions. Do you have any operation on your tummy or down below?
No.
Any allergies to any known food substance or any drugs?
No.
A few personal questions, like everything good in the family? Anything of concern you would like to tell me?
No, I'm fine. My partner is very supportive. Everything seems to be good.
That's good. And about your habits, I know it would sound intrusive, but since I'm meeting you the first time, I would like to know, do you consume alcohol?
Weekends, yes, I do.
Right. Just to tell you, alcohol is something that you would avoid in pregnancy. And if you want to give up, I could put you in touch with a counselor for that. Okay.
Yeah, the thing is because I didn't realize I was pregnant. After I've been told, then I've stopped. Yes.
All right, that's good. What about smoking?
No, I don't smoke.
About any recreational drugs?
No.
Do you know your blood group, Louis? And the type?
O positive. Yeah, it's O positive.
Okay, in case you would need a blood transfusion for any reasons, do you have any reservations for that?
No.
And about your height and weight, something we call as BMI? Any idea what it
It's
is?
normal.
All right. Okay. Thank you so much for this information, Louis. Now let's get back to your result. Okay. So I have confirmed your name, and I'm sure this result belongs to you. Okay. Louis, I am about to give you a lot of important information, and I see that you are alone in the clinic today. So, do you want to call someone to be with you during the consultation?
No, I've come all alone. Is everything fine?
Um, yeah, the thing is, I'm afraid I don't have really very good news for you, Louis.
Okay, what's
So,
it, doctor?
can I ask my midwife to be with you in the consultation?
No, I'm fine. I'm fine. Please go ahead.
I'm very sorry, Louis, to tell you this, but the radiologist, he has confirmed that the development of the brain of your baby, the bony part which covers the brain, what we call as the skull cap, has not developed.
What does that mean? So, I mean, can you do something? Can you give me some medicine to make sure that the baby grows well?
I'm sorry, Louis, but that is not really possible. It is a condition that is called as anencephaly. And in this, something has gone wrong during the development process itself, and your brain is exposed and it doesn't have a bony covering.
Oh, so is it a very serious one? So anything can be done, or how is that?
I'm sorry, Louis, but there is really nothing that we can do about this condition. And sorry, the outcome for the baby is not really very good.
Oh, probably it's all because of me, because obviously I didn't know and I didn't take any tablets because I don't know. But how would I tell my partner? Because I don't know. I feel so guilty of doing everything wrong.
No, Louis, you should not blame yourself, because really we cannot say that it is something that you did or something that you did not do. Right now, we should focus on your well-being, and we can see what can be done about the baby. But please don't blame yourself. It is not something that you did or something you did not do that has caused this to happen. There are multiple factors due to which this could have happened.
So you
Okay.
mean to say that this is a life-limiting one for my baby?
Yes, I'm very sorry, but it is something called as a lethal anomaly, in which, by which I mean to say that uh, even though the baby might be born alive, but it cannot survive.
Oh, okay.
Okay.
I just want to tell you one thing because I definitely want to continue with the pregnancy irrespective of the outcome because that is something which I believe very firmly. So, is that
Right.
possible? Because I don't want to end this pregnancy.
Definitely, Louis. We respect your decisions. And if you decide that you want to continue this pregnancy, we would be offering you all the care that we would be giving to other women. And your decisions would definitely be respected. But before that, I would like to tell you about how your care would be and what would be some of the problems that you could encounter during this pregnancy.
Okay.
Okay. Can I go ahead now, or do you want to come back with somebody when you are well supported?
No, because obviously this was not something which I had expected. Obviously, pregnancy wasn't only expected, but now it's a little tricky, but that's fine because I would want to know what it's all about.
Okay. So now this is something that is called as a high-risk pregnancy. So you would be booked in a consultant-led unit, and we would give you all the care that we give to other women. Okay, so whenever you come in, as per the schedule, we would be checking your pulse rate, your blood pressure, and your blood according to the guidelines. We would be seeing how the baby is growing. Now, like I told you, there could be a little few problems during this pregnancy. Okay, so because the skull cap that is covering the brain of your baby has not developed, It gives rise to a condition which is called as polyhydramnios. By that I mean that in the womb, the baby is surrounded by fluid which is called as amniotic fluid, what we call as water, right? So there could be an excess of this water. And because of this, you could be having excessive stretching of your tummy. You could have trouble breathing. Are you with me, Louis?
Yeah. So that means to say it will have effect for me as well. Okay.
Yes, there could be some concerns for you. And during labor, there could be a tendency for you to cross your date of delivery. Okay, normally women tend to give birth at around 40 weeks of pregnancy. So sometimes there could be a tendency in which the babies have an encephaly that you might not start labor on yourself. Okay, and
Okay.
we might have to give you some medicines for that.
Okay.
Okay,
Okay.
and yeah,
Yeah,
I
after the delivery, like, will I get some time to spend with the baby? I know it might not be something, I know I will be definitely be worried looking at the baby and all, but definitely I would want to hold the baby for some time. Is that all allowed?
yes, definitely we would allow that. All your wishes would be respected. But I have to tell you that the appearance of the baby would not be something which is very pleasant. I'm really sorry to tell you this. Okay.
Okay.
I could
Okay.
show you some pictures. I would be giving you some information leaflets so that you can prepare your mind for that.
Okay. Fine. I know this is going to take process some time, but I want to know the could I have done something any different because I don't know what's the possibility that next time also I get a baby like this. Is there anything which I can do to make this better?
Yes, definitely, Louis. What we would like for you to do is the next time you can plan your pregnancy, and there is a vitamin called as folic acid, which we would like you to start at least 3 months prior to you planning the pregnancy. And once you know that you are pregnant or the pregnancy test is positive, you should be consulting your GP, and we would arrange an ultrasound scan at the earliest because this is a condition that can be picked up by about 10 weeks of pregnancy.
Okay.
Okay?
Okay. Yeah.
Are you with you? Are you with me?
Yeah.
So, do you have any other questions, any other concerns for me?
No, also I wanted to know, like, you said that I might not start off my labor. Does that mean that I would need a cesarean sections or anything? Because I want to keep that natural as much as possible.
Coming to that, we would try and give you a natural birth as far as possible, but sometimes because the top part of the head is not well developed, there could be difficulties in delivery. So, on very rare occasions, you might have to undergo a cesarean section. That is one possibility.
Okay.
And labor could also be a little bit traumatic for you. There could be, some um, more bleeding after the baby has been born, something we call as postpartum hemorrhage. So that is one thing that we have to keep a mind on. And it is advisable for you to deliver in a hospital where expert care is available for you. Okay,
Okay.
Yeah, so these are some of the few things that you have to keep in mind. I would be giving you some information leaflets, and your decisions are always welcome. I would also book you with my consultant. So, in case you have any other doubts, any other queries, you could always get in touch with us. These are the phone numbers, and any concerns you have, you can always get back to us. Okay, Louis?
I'm fine. I think I'm okay. Whatever you said, but definitely this was not something which I had expected, but I
I
would
am
discuss with my partner as well. Yeah.
I'm really sorry for this. And in case you need further help from us, would you feel better talking to a counselor about how you feel about the baby. We could arrange for that for you.
Yeah, probably I would need one, yes.
Sure. I would make an arrangement and get back to you at the earliest. Okay. And one more thing, Louis, are you comfortable going home alone, or should I arrange something?
No, I'm fine. Thank you.
I'm sorry once again, Louis, for being the bearer of this bad news. But remember, you are not alone. We are always here to help you, and please get back with any concern that you have.
Okay, thank you.
Thank you so much.
Thank you. Yes, Chitra, I think it was well done, the empathy, sympathy part. But only thing is probably when you break the news, like you said about warning shot and, like probably immediately after that, that I am afraid I don't have a good news. And the first thing you would be saying is the scan shows that the baby has a life-limiting condition. Okay, so you say that, so it gets to me very well. And then say about what is it. So that's the only thing which I felt. Otherwise, I think it was fine. Otherwise,
should we redo? It's okay.
No. This was fine. This is absolutely fine because your explanations, everything was fine. My only suggestion would be to so that as a role player, like as a patient, when I'm talking to you, I'm probably worried that probably
it's not a, it came a little bit later that it's a lethal
yes, that's the only thing. Otherwise, I think it went on very well. Yes, please. Yeah.
Okay. All right. Thank you so much.
Thank you. Yes.
So I think I will go ahead with the rest of the slides. So Akhila, how to do that? I will share my screen. Is my screen seen now, Akhila?
Yes, ma'am. I can see your screen.
Okay. So that is how you do a station for breaking bad news. Okay. So first, now, I don't know how to move my slides forward. I will stop screen sharing and then I'll get back again.
Oh, okay, ma'am. Fine.
Because and I will share my screen again. Okay. All right. Can you see my screen now?
Yes, I can see.
So this is how this station that we did just now, this is called as breaking bad news. So what exactly, all right, before we come to that, from your exam point of view, in the exam, the marking system that is there are two parts to that. The one that is evaluated by your examiner, and by the role player or by the patient actor, he or she, whoever is there. Okay. So 50% is for the content that is provided by the candidate and 50% is for your communication skills. And then based on this, the global impression is given by the examiner as to whether you have passed the station, it was borderline, or it is fail. Okay. So content of information that is given by the candidate, it is basically your history taking, which is marked from 0 to 3, the way you are explaining the scan report, and then the management plan. So that constitutes 10 marks. Then your communication skills, they are evaluated both by the examiner and by the patient actor himself. So by the examiner, they would be looking for the introduction that you give, whether you are giving support or not, a warning shot has been given or not, whether you are picking up the non-verbal clues, and empathy. And false assurance is being avoided or not. Like in this patient with an anencephaly, the candidate should not be saying that, no, yes, the pregnancy, everything is fine and your baby is going to do fine. If you say like that, you are going to end up getting 0 marks. Okay. Now the patient actor, how he or she has evaluated you. So whether you are professional or not, and you are allowing time for the role player to react or not. Like, so whenever you are giving bad news, you deliver the bad news, wait for some time for the patient to react, and then continue forward. Okay. And you should also allow the role player or the patient actor to express thoughts, their concerns. Okay. And always respect their belief and autonomy. So if you are doing all this well, then the examiner, like globally, they would evaluate you as pass, borderline, or fail. Okay. Now you can pause the video here for a minute or two, and this is all the things that you have to be asking in history taking. How is your communication going to be, and knowledge. So knowledge here, basically you have to know that anencephaly, it is a lethal anomaly. The baby is not going to survive, and it's perfectly normal in these situations to offer termination of pregnancy. But if the patient actor thinks that no, I do not want to terminate this pregnancy, I want to continue the pregnancy, you should be aware of what is the risk to the mother, and the baby, of course, is not going to survive later. Okay, so honor the wishes of the patient actor and then tell her how the pregnancy is going to go forward. Okay, so these are all the things that you have to see. And here, remember, here she has come for booking at 20 weeks. So remember to ask that is everything all right at home, whether she's well supported at home, there is no domestic violence or domestic abuse. So why she is a late booker, that is the thing that you have to explore. Now, basically, what constitutes bad news? Okay, so any news that will drastically and negatively alter the patient's views of her future, that is considered to be bad news. Like here, this woman, she is looking forward to a pregnancy, and she suddenly realizes that her baby is not going to survive. So whatever plans she had for the child, for the future of the child, all that has collapsed. So that has altered her perception of the future. In breaking bad news, typically you would be getting cases like this. Someone with anencephaly, or any woman, early pregnancy, she has come with bleeding. So it could be a missed miscarriage, it could be a molar pregnancy, it even could be an ectopic pregnancy, or any woman who has come with reduced fetal movements, a scan has been done and it shows that there is an intrauterine fetal death. All this constitutes breaking bad news. This is about obstetrics. Now in gynecology, diagnosis of any kind of cancer, be it cancer of the ovary, cancer of the endometrium, or cervical cancers, all this constitute breaking bad news. So these are the typical stations that you can expect in the exam. Okay. Now you can follow this spikes model whenever you are doing the station for breaking bad news. Okay. So what does spikes mean? So setting. So the setting, like the atmosphere, do you have enough privacy? Okay, you don't want 10 people to be around you whenever you are breaking the bad news. So make sure that there is enough privacy. Then perception of the bad news, whatever is there. Invitation, that means you are asking the role player to come and sit with you, and then you will explain. Knowledge of the condition, basically the doctor or the candidate should have a good knowledge of the condition, and also the management. It is not that you will only break the bad news and end the consultation. It doesn't work like that. You also have to formulate a good management plan for the future. Okay. Take care of emotions of the patient, offer a lot of empathy, because this is something that you are delivering a very bad blow to her. She has not come to you expecting this type of news. So the patient or the role player has to be very well supported during the consultation. And then the end, you can make a summary, and strategy means what is the future management plan for this condition. Okay, so keep in mind these few things. Now, whenever you start this consultation, step one would be think whether you are the right person to break this news. Whether you are a doctor and you have good knowledge of this condition. Okay, whenever you are breaking, you're telling something bad to the patient or to the role player or the actor, you should have enough knowledge of the condition and also how this condition is going to be managed. So make sure that you are the right person to break this news. Think of what you are going to say, the right words that you are going to talk to the patient. Ensure there is privacy, the patient is comfortable. Confirm the medical data. That means make sure, okay, confirm the name, age, if there is a hospital number on the reports, and confirm that you are talking to the right person. Do not mix up someone else's reports with someone else. Okay. And make sure you have adequate time. With the consultation should not be something that is very hurried. Make sure someone else is there. So if the patient wants some support, you can wait for some time. You can ask her. She can call her husband, or her partner, or her parents, or a close friend. If no one, you can offer a midwife to be with her during the consultation. Second is, how much does the patient know? Okay, so ascertain whatever she knows. You can ask her, like, what is your understanding of, you can tell her the name of the condition. You can ask her, what is your understanding of this condition, or what exactly has the sonographer or the radiologist told you about your condition. Okay. Then the next step is, how much does the patient want to know? There would be some patients who want to know in great detail everything about the condition and the management plan. Okay. So the first thing is, does the actor want to know the results first, or is it okay if you ask her a few questions? Always respect whatever the role player says. Then the next is, how do you say it? So be straightforward. Don't go beating around the bush. Okay, but remember, always first use a warning shot. Say, okay, I'm afraid I don't have very bad news, or we have an unexpected finding on the scan. Okay, then you tell what is the bad news or what is the finding of ultrasound. Wait for a few seconds. Wait for the actor to respond. Okay, and then go forward in the consultation. Okay, so when you are actually doing the exam, if there is a glass of water, you can offer a glass of water. If you see that the actor is crying, you could offer some tissues for her to wipe her tears. Okay. And another important thing to remember is that always give information in small chunks. Take a break in between, ask the role player, am I clear to you? Am I with you? Okay. And then go forward. And always avoid medical jargon. It's understandable if you use medical jargon, but explain what that medical jargon means. Okay. And do not minimize the severity. Like if you have something, a lethal condition, do not tell her that, okay, no, maybe the baby will survive. If you say like this to someone who has anencephaly, you would be marked 0. Okay. So the severity has to be told, okay, do not to the actor, and do not give too much information at one time. So give it in chunks. The next thing is respond to the feelings of the patient. Like, don't interrupt whenever she is talking. Listen to what she has to say, and then you go ahead. Okay. Another thing is non-verbal communication is very important. Look at the body language, look at the facial expressions of the actor. Okay. So she could just remain silent, or she could be crying. So it's important to pick up those clues that she's giving you, and always allow time for her to respond. Don't be in a hurry to finish the consultation. Okay, acknowledge her emotions. Now the last step is step 6 on follow-up. So you will have to give contact information. You can give numbers to the hospital. You can give helpline numbers and discuss what is going to be the follow-up. You can give support groups. You can give leaflets. Okay. And very important, because in the European countries, if they have come alone, or if you are giving something of a bad news like an ovarian cancer or an endometrial cancer, remember these patients could be old patients, and they could be so overwhelmed by the news that you are giving them. They would not really know how to go home. So it's always a very good idea to ask her, does she need any support to go home? That is one thing that is going to give you more points from your patient actor. Okay. So these are the important things that you have to do whenever you are discussing breaking bad news. I hope this video was of help to you. Thank you so much for watching the video, and good luck to you for your exams. This is Dr. Chitra. Thank you once again, and good luck for your exams. Bye-bye. Take care.